In this video, I'm going to share with you my 7 top steps to use your blood pressure monitor at home correctly. And by the way, the last few steps and tips you're never told about. So let's jump straight into step number 1. You've got your trusty blood pressure monitor, okay? But what I want you to remember is 30 minutes, okay? Remember, do not take your blood pressure within 30 minutes of eating, smoking, drinking caffeinated drinks, or exercising. And why should we wait? Well, all of these activities can temporarily increase your blood pressure, and we want the most accurate blood pressure reading. By the way, stick to the very end because we're talking cuff sizes, and also we're making it easier to understand what your blood pressure readings mean. Step number 2, relaxation, okay? So find your spot you're gonna do your blood pressure, a nice table that you can get your legs underneath, a nice chair that's got back support, okay? And you're gonna have your arms fully supported on the table. That is very important. And your feet flat on the floor, okay? Next, you're gonna take a 5-minute breather, okay? A 5-minute relaxation before we do the blood pressure. And this relaxed posture is key to you getting accurate blood pressure readings, okay? Do not cross your legs either. And also, if you need to go to the bathroom, go to the bathroom before we start taking your blood pressure, okay? Because all of these are gonna abnormally increase your blood pressure and not give us an accurate reading. Straight on to step number 3, cuff placement. This is critical that it's done right so you get an accurate reading, okay? If you're wearing a watch, take it off. If you're wearing a tight shirt or a tight jumper, you need to take it off. It's best to wear a t-shirt, okay? Because all these can affect the readings. Right, put the cuff on your arm like so. You want it, so the bottom of the cuff is about 2 fingers from your elbow, okay? That is the ideal location. And then wrap the cuff so it's pretty snug, the fit, so you can just about fit 2 fingertips in there. That is the perfect placement. Step number 4, cuff alignment. Now some cuffs have a little marker which you line with your middle finger. Others require you to have the tube in between your middle finger. Some require both. Read the information leaflet exactly how it's done on your blood pressure monitor. The reason for this is this needs to be in the right position so that it can detect the little vibrations to calculate your blood pressure. And remember, the correct cuff size is crucial for accurate readings. If it doesn't fit correctly, you're gonna get inaccurate readings. I have a video all about how to pick the right cuff size. Straight on to step number 5, final checks. Make sure the cuff is in line with your heart, you've got a correct posture, your arms are supported, your feet are flat on the floor, you're not blocking the air tube with your arm. And also, when you click that start button, no moving, no chewing, no talking, no laughing. Okay, let's press start, let's go. And straight on to step number 6, after taking your first reading, wait a minute and then repeat again. Next up, here's my pro tip for blood pressure monitors and making sure that the blood pressure monitor that you are using is clinically validated for accuracy and on the validated device list known as VDL, either by the American Medical Association, Hypertension Canada, or the British and Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that you can buy on Amazon, for example, are not on the validated list, which basically means they are not accurate. Now, I have been using the A&D Medical blood pressure monitors in practice for years because 1, they are a workhorse when it comes to blood pressure monitors, believe me, and 2, they are clinically validated for accuracy by all of the organizations that I just mentioned, okay? And the way they do this is they do a formal study comparing the readings from this monitor compared to, let me show you without dropping everything, compared to this, okay? The manual SPIG and stethoscope readings. The A&D Medical team are very good friends of the channel, and to learn more about A&D Medical and their brilliant products, I will leave a link to their website in the description below. Definitely do check them out. A&D Medical, thank you for being our trusted sponsor. Moving straight on to step number 7, know your numbers. I'm gonna make this very simple for everyone watching. Unless you are told otherwise by your medical provider, you should be aiming for a home blood pressure average of no higher than 130/80. If it is any higher than this, please speak to your medical provider because high blood pressure can increase your risk of cardiovascular issues, kidney damage, and stroke.